So welcome everyone. This is the MFCA's third webinar that we've done. I appreciate you joining us. My name is Mike Stack. I'm an MFCA board member, as well as an exercise physiologist and founder and CEO of Applied Fitness Solutions. I'll be moderating our panel today. And before I introduce our guests and we launch into this, just want to do a little bit of housekeeping right off the bat. First off, this is Zoom webinar, meaning you can see us, you can hear us, but we cannot see you or hear you. The chat and the Q&A feature are both enabled for everyone, so please feel free to utilize that to ask questions throughout. If the question is relevant for that point in the webinar, I'll make sure I bring it up to the panelists. If it's something that's best tabled towards the end, then we'll do that. There also will be a period of time at the end. We'll try to give 5 to 10 minutes to answer any questions that anybody has. And as I mentioned previously, we'll be sending out a recording of the webinar afterwards to all of the attendees, so you have the opportunity to view it. And then if there's anything we specifically talk about in terms of research or items that might be helpful to share, we will push that out afterwards as well in the email. And then I think the last thing I would ask everyone is, I think you're going to find this information is going to be very valuable in talking with the three gentlemen that we have here today. Prior to getting this plan, I was very excited to bring this information. And if you do find this valuable, please share with your network, please share with your colleagues. I really believe what we're going to talk about today is so critical for not just the survival of our industry, but also for the health of our population, that I really want to make sure that this information gets out there. So with that said, I don't want to waste any more time. I want to introduce our three panelists, get into a little bit of an introduction, and then start this conversation. So I'm going to start from my top left with Dr. Tom Rafai. Dr. Tom is the head of, or was the former head of metabolic health and weight management at Henry Ford Health Systems. He also worked at the Pritikin Institute, which is a world-class cardiovascular rehab center down in Florida. And now he's made his way into the private sector with his company, Reality Meets Science. So he's essentially a lifestyle medicine expert. So we appreciate you joining us, Tom.
Thanks, Mike. I appreciate it.
Next, moving down on my screen to the left is Dr. Anthony Moreno, Tony, as I know him. He's a PhD professor of health promotion and human performance at Eastern Michigan University. And one of his specific areas of interest and expertise is in physical literacy, or getting us moving a little bit more. So we're going to unpack that topic today. Tony, thanks for joining us.
Thanks for having me. Thank you, everybody.
And last but certainly not least is Dr. John Evans. He's the director of mental conditioning for Blend Health. That's spelled BLND Health. He holds a master's degree in counseling psychology, and his doctorate is in sport and performance psychology. John, thanks for joining us.
Thanks, Mike.
The thing that I love about the three gentlemen that we have on here today is I definitely can call them all close personal friends, but they're also really cool in that they're not going to expect me to call them Dr. Rafai, Dr. Moreno, and Dr. Evans throughout this. That's not how these three guys roll, which I think is why they'll connect with you so much. So we're going to dispense with the formalities right off the bat, which is nice for me, who is the one person that you can't call doctor on here. So I appreciate that. But guys, I want to get into this, and I want to get in this with a little context for everyone that's listening. And I don't think I'm about to say anything that people don't already know, but I think it's important to level set before we start here. Certainly COVID-19 has changed our world in unimaginable ways, some that are very, very visible and some that are much more subtle. And I think the one that is the most subtle and insidious is the disproportionate impact that COVID has had on physical activity, obesity, and mental health. And really, these are all three critically important pillars of health. And the pandemic has only exacerbated the issues that were here beforehand. A lot of recent research, and it seems like more and more research comes out every week, that inactivity levels and weight gain are on the rise. Mental health issues are accelerating at an alarming rate. And this sits against the backdrop of the stunning pre-pandemic statistics that we all know. National obesity level above 40%, less than 25% of Americans meeting the CDC and the World Health Organization's physical activity guidelines. 1 in 4 adults suffering from a mental health issue. That was pre-pandemic, and we're only now starting to see the statistics come out after the pandemic. So this is the tip of the iceberg in terms of a growing public health crisis. And as sobering as the public health implications are, the economic impacts could even be more devastating. I think we all know that COVID-19 has been devastating from an economic standpoint. But when you start to look at the cost associated with obesity, inactivity, and mental illness, those are estimated to exceed $420 billion and account for over 40% of our healthcare expenditures by the end of this year. Those are staggering, staggering numbers. But despite all that, there's hope. And hope is really what we're here to talk about today with these three experts. It's lifestyle intervention at the community level, implemented in fitness centers, community rec centers, and even at home that can really combat this mushrooming crisis. The situation is definitely urgent, and that's why we're here to talk about it today. And we have to move towards implementing interventions with a degree of deliberate speed and focus that combating any pandemic requires, have it be inactivity, obesity, and mental illness, or the COVID-19 pandemic. So today we're here to talk to these three experts about that. And with that as a little bit of preamble, I want to get right into it. And I want to get right into it with the physical activity component, because I think that we, if nothing else, are an industry of physical activity advocates. And I want to pose this to Tony to start, to talk a little bit about physical literacy and what it is. And then I guess the follow-up question is, why do we seem to be becoming less physically literate as a society?
Sure. And let me add a little bit more context. I am a former fitness facility owner in Mammoth Lakes, California. I had a facility for 6 years. And my background is actually where Mammoth Lakes is located in the eastern Sierra Nevada. And so I want to come at this from the perspective as a fitness facility or gym owner, because I know what it's like to be in that position, to always be striving to market your goods and your services that you really stand behind and you're passionate about. So if you look at the research literature textbook definition of physical literacy, it's very similar to what we see with literacy. Literacy, that you can read anything from a comic book to a romance novel to Wikipedia to a broad range of reading materials in a variety of contexts. Or numeracy, your ability to be competent at doing a variety of mathematical operations, whether it be addition, subtraction, or calculus or trigonometry. It's just your motivation, your confidence, your competence, knowledge and understand the value and take responsibility for physical activity throughout the lifespan. That's what physical literacy is. That's the most simple textbook definition. If you have the competence and the confidence to participate with movement or physical activity, you're more likely to do it throughout the lifespan. And one of the things that we lack right now is a physically literate culture. We are actually physically illiterate. And we have been physically illiterate. The trend has been that way for quite some time, probably 40 to 50 years, that we've been able to actually how physically active Americans are. So we are a physically illiterate culture. And when you're physically illiterate, you're just not a physically active person. And when there's a decrease in physical activity, well, obviously you have increases in overweight, obesity, metabolic syndrome, adverse mental health, increased health and medical care costs, increased time lost workplace productivity. You have all these things that we always are complaining about that we call issues. So how do we turn that around? Well, we turn that around becoming more physically literate. And so why are we less physically literate right now in the United States? Well, there's a decline in physical activity among all segments of the population. And more alarming, especially for you as a health club owner or a gym or a facility owner, when our youth are physically illiterate, what we know, what the research tells us is that they're less likely to be physically active later on in adulthood because they're not physically literate. They're physically illiterate. And these are things that we've known for quite some time. The research is out there. We know that the trends are bad, and this is all pre-COVID. So this is not anything new. And so if we see a decline in physical activity, a decline in the opportunity for participation in community recreation programs, a decline in physical education in schools, well, obviously we're just manifesting or contributing to this physically illiterate culture. And fitness facilities and health clubs are an important part of that, because I know for myself, when I go to a gym, I like to play. I play basketball, I play handball, I do some weightlifting exercises and things of that nature, because to me that's fun. But I've embraced that form of exercise or that form of physical activity because it's important to me. I understand its value, and I have that confidence and physical competence and knowledge of what it does for me. And when you eliminate that from the school setting, well, where do people learn to become physically literate? So fitness facilities and gyms and health clubs and things of that nature are an important part of perpetuating or sustaining that physically literate journey. It's a journey. It's not this thing. We don't measure physical literacy. It's a concept. It's a disposition. And because and the fitness industry is important because the prevention is always cheaper than the cure. It's cheaper than rehab. And I'm not going to tell anybody anything new here. One of the things that we have to think about in your place as a gym owner, if I was in your shoes, this is a marketing thing. If no one is interested, you're not interested. So sometimes we have to meet our market niche where they're at. So this is why physically literate to me is a very important concept for community recreation, for schools, and for the private sector, health clubs and gyms to embrace.
Yeah, those are excellent points. And for everyone that's watching, we're going to get into actionables at the end of this. I want to just, again, level set and provide some context here. But interestingly enough, Tony, and for everyone that's listening, I actually had a conversation yesterday with a woman by the name of Lori Witzel, who's the senior advisor to the Physical Activity Alliance, which is basically a conglomerate of several different organizations that are coming together to try to promote physical activity. And one of the biggest things that she said was critically important was the public sector and the private sector coming together to address this issue. And I think we saw that with the development of the COVID-19 vaccine. And I hope that's just a springboard to come. So I think a lot of your actionables that we'll get to towards the end, I think are important. But you said it. If our kids are less active now, they're going to be less physically literate in the future, which means for gyms and fitness center owners or operators, that's your market. And if those people aren't there, then we don't have a market. So critically important issue, as is obesity, and very much intrinsically tied. I think as we talk about activity, obesity, and mental health, we can't separate these from one another because they all are tied together to varying degrees. And that's where I want to go to Tom next to talk about obesity being on the rise and in an accelerating fashion. And it seems as if we're failing as a health science community and even as a fitness community to a degree to address this. Why do you think we're seeing the staggering increases that we're seeing, and why are we failing so systemically, Tom?
Well, I appreciate the question. In all honesty, if I was to be able to try to summarize a complex problem in a nutshell, it's our environment. You know, we have from the lazy boy chair culture on up. I mean, we've gone from physically active jobs in which it was just a natural part of our living to more cerebral jobs that really, I wouldn't say force us to sit, but that's what we thought, you know, was the natural way of doing things until now we started realizing to some degree sitting, standing, you know, desks and treadmill desks and so forth. And we have a very, very permissive food environment, you know, to complement the lack of physical activity. There's a lot of, if you will, what I call crap foods, which is calorie rich, refined, and processed. So it's not quite spelled the other way, but it sounds the same way, and it's omnipresent. I mean, it's well beyond the exposure to cigarettes. I mean, everywhere you go, starting from Bye Bye Baby on up, we're constantly exposed to really calorie dense, calorie concentrated, and foods and food-like products and beverages and so forth, and they're very short-term reward oriented, and so therein lies at least you know, some real facts. Some areas considered, you know, complete food deserts, meaning healthy food deserts. It's a real challenge. I mean, it's in there, but amongst just a plethora of foods that and frankly difficulty in terms of being physically active as well, that is challenging. I mean, whether parks are even lit or safe to go to in inner cities, the challenge, the cost of going to a facility, gym facility, might be an issue. And I just want to say that one thing, though, of course, my specialty focuses in part on the manifestation of our metabolic disease epidemic in terms of weight. But I do want to emphasize that if you look strictly at the American Heart Association Simple 7 criteria of physical activity, food intake, smoking, blood pressure, glucose control, cholesterol, and of course, weight is one of them. only about 1% of Americans meet ideal for all 7. So there's plenty of people who are normal weight who may be so-called skinny fat. At least one Mayo Clinic survey did DEXA body composition analyses and found high body fat percentages but low weight because the scale is really just a useful idiot. If you gain 20 pounds of fat and lose 20 pounds of muscle over 30 years, the scale just says, I don't know, you weigh the same as you did 30 years ago, but metabolically you're in some tough shape. So it's really lifestyle and physical activities for everyone, irrespective of weight, and weight is just one manifestation of the problem, if that makes sense. And this is a real concern in terms of cost, as you mentioned, Mike. You pointed out something really critical. If we look at the fact that there's, just for one perspective, in the pre-diabetes, 90 million estimated pre-diabetics. Sadly, talk about awareness, maybe 80 million aren't even aware they have it. That being said, the medical cost of pre-diabetes, which I would actually call chronic insulin resistance with early beta cell or insulin producing cell failure, not really pre-anything, is about $500 in medical costs. Once you shift to type 2 diabetes, even undiagnosed, it goes up to $4,000 a year. Once you become diagnosed type 2 diabetic, and then you need the ophthalmologist and the podiatrist and the labs every 3 months, it goes up to $11,000 a year. And those trends are frightening. So there's really only one true vaccine for all of this, and that really is ultimately lifestyle medicine with physical activity as one of the critical pillars at the top.
I think the point you just brought up can't be understated enough from a numbers perspective. You said there are 90 million, estimated to be 90 million pre-diabetics, and about only 10 million of those 90 million actually know it's an issue. And if there is not awareness, then there is no way to address the problem. And we'll talk about the role that physical activity and the fitness industry can play in that. But as I'm sure you'll touch on, Tom, with some of the data from the CDC's diabetes prevention program and then your own diabetes masterclass, the powerful role that lifestyle intervention can play. And we as an industry are a critical constituent of that lifestyle intervention. So thank you for that. I want to move on to mental health quickly. Again, just to level set, we want to get some actionables here really quick for the gyms and fitness center owners that are listening. And so, John, I want to move to you next. And mental health seems at times to be forgotten and maybe even taboo to talk about. Fortunately, I think we're getting better as a society of talking about it, but certainly in the context of COVID-19, it's been more the physical health that's been of greater concern, and mental health has definitely taken on a little bit of a place in the back burner. Where are we at right now with our mental health status in this country, and what's the trajectory seem to be?
Yeah, thanks, Mike. And I think first what I would say is what can't be disentangled is the 3 areas that we're talking about right now. Like there's no, it's a combined detrimental or virtuous or vicious cycle when you talk about mental health and physical health. So they are so intertwined that and COVID has been such a killer and destroyer of both mental and physical health. But I mean, I think what I would say is it's just throw out just a few statistics. Back in January 2019, about 1 in 10 adults was reporting symptoms of anxiety or depressive disorders. Now, as of January 2021, it's 4 in 10. So that in and of itself, to me, is staggering. Impacts on sleep, detriments to sleep are up around 36%, eating 32%, increases in alcohol at 12%, worsening of chronic conditions, 12% increases. So suicidal ideation up from 11% to 26%. So you talk about, how mental health is being affected and like, look, this has all sorts of, antecedents and I think mechanisms associated with it. And I think that's where some of the important information comes in. It's the repetitive and mundane nature, I think, that we've been experiencing over the last year. It's this intolerance of uncertainty that we have, fear, whether that's health, financial, relationships, all of that is this breeding ground for anxiety and depression. And then all of that is going to be this perpetuating downward cycle in physical literacy, physical attention to physical health, nutrition, sleep, whatever it is. So all of these, you take, this last year of the pandemic, and what we've seen is what I've used is basically is this really what I consider to be a really great model of human motivation, self-determination theory, where you talk about autonomy, connectedness, and competence, right? You talk about Tony's area of this physical literacy and competence, has been decimated by COVID. The inability to go to the gyms, the inability to college athletes, whether it's academic or just college goers in particular, in any way, shape, or form of kind of increasing competency has been hurt. Autonomy, the ability to kind of do those things on our own, make our own decisions, go to the gym, go meet friends, go for, to my running group, that has been, and then of course, connectedness, our ability to socially connect in these environments. So, motivation in and of itself for physical health and activity, for seeking out and mental health, for our ability to manage mental health in and of itself has just been destroyed by COVID. And, I'm sure you added the actionable piece, maybe specifically for me, because, I like to jump into that, but I'll hold off. But I think that's like some of the places where, we have seen that this is just becoming a bigger and bigger problem. And they're affecting each other less, it's a cycle, less physical health, more depression, anxiety, more depression, anxiety, less motivation and action to address physical health through exercise, physical activity, and nutrition. So,
yeah, so we are into this vicious cycle, and one thing I don't want to gloss over, because I think it's important to mention. I know because I've been living this with a lot of the people that are on this right now, is that we aren't on a pedestal and immune to these things as gym and fitness center owners and operators. I think we have dealt with a decent degree of stress and mental health concerns over the course of the past year here. So while we're going to be talking about things that we can operationalize into our business to help address this growing pandemic in the pandemic, I particularly think some of the things that John's going to talk about as we get towards the end here in terms of things that we can do to help our clients and our members that walk through our door, I also think are things that we can use ourselves just to maintain our own mental health. And as I always like to remind people, put your oxygen mask on first before you assist others. We're all caregivers, and if we're focusing on giving care to everyone else and not taking care of ourselves, that's the classic caretaker-itis that we could all come down with that can really short circuit our motivation. So I want to tease that when we get to the end, I think John's going to have some really, really good suggestions, not just for the people we work with and want to help, but also for ourselves. So I appreciate that. And I want to pull this out of doom and gloom really fast. We're 20 minutes in. I think if we haven't already beat the dead horse of we're not in the best spot, going in, I think we now certainly know that with some data from these three gentlemen. So now I want to talk about how we can address this, but I want to address it, talk about that addressing through the lens of our industry. Again, gym, fitness center, owners and operators, fitness professionals. How do we actually go about helping combat this? So I want to go back to Tony to start. And I want to talk about how the fact that gyms and fitness centers, we are on the front lines of addressing this to a great degree. That public-private partnership that I talked about with Lori from the Physical Activity Alliance, we are very much a part of that. And so, Tony, from your perspective, what should we do as an industry to focus on supporting our nation's public health system? Oh, you're muted, Tony. The most said words this year of anything is you are muted.
You are muted. Yeah, sorry, I apologize, everybody. So, if you're not looking at this, that the glass is half full, you're in the wrong business anyway, right? From our perspective. So, you mentioned the National Physical Activity Plan, the National Youth Sport Initiative. That's another initiative out there, Healthy People 2030. There are a number of initiatives that have been out there for quite some time, but are supported by a number of organizations. And so when I look at this from an industry perspective, we need to educate ourselves so that we can align. That's one of the things in the United States, there is no alignment from the federal level in terms of how I disseminate education as it relates to health and what being and physical activity and things of that nature. We don't have this minister of sport or this minister of physical activity that oversees all of these things at the federal level, that kind of works itself down to the state level, so on and so forth. So really, it's up to us. We're at the front line. You're like a firefighter battling a wildfire, because it is a wildfire. And you have to think about what you can do in your neighborhood, in your community, in your city, to continue to offer that quality program that can reach a broad audience. That's what you have to do. It's on you, seriously. And many people can't afford, when you look at this thing from a neighborhood or a community or in your city, many parts or many portions of that community will not be able to afford your services. So how can you, as a facility owner, gym operator, whatever it might be, how can you co-brand with what exists in schools? How can you work with physical education? How can you work with city community recreation to create innovative and novel programming that generates the opportunity for people to become physically active so that they can learn how to move and appreciate what movement does to become a physically literate culture? And from your perspective, this enhances the opportunity for you to generate other revenue streams. I mean, again, when I was a gym owner, I was a 3,000 square foot space, and my major competitor was a 50,000 square foot full scale health club. So my back was always against the wall. So I'm used to playing that role of underdog, and I'm sure many of you are as well. And so you have to think about, what can I do in my immediate vicinity to align with how we say things occur at the federal and the national level. And this includes the National Physical Activity Plan Alliance, Healthy People 2030, and the National Youth Sport Initiative. There's a number of initiatives out there, but there's no teeth to any of those initiatives. You are the teeth, because they just put out white papers and position statements and a review of literature, and it goes and sits in a journal that maybe a couple hundred people will read it, but it just sits there. And that's the way it's been since 1970. So you are the teeth. You have to make things happen.
Yeah, I think the point about the looking at some of these documents, I put in the chat. I dropped it for everyone. We'll also send some things out after in email that Tony mentioned. But that's the National Physical Activity Plan. And when you read these documents, the thing that strikes me about them is that the plan is there. And you've said this many times before, Tony. We don't need another study to tell us that we need to be more physically active. We need boots on the ground to get people doing that. And I think aligning with your local public health department, aligning with your local parks and rec departments. The MFCA has had conversations with MParks. MParks is the trade association for the park and rec departments in the state of Michigan. And they are horribly under-resourced and underfinanced right now, and would love to have collaborative partnerships. So even reaching out to your local parks and rec departments, your local senior center, saying, hey, what can we do? And maybe you don't make a tremendous amount of money from that reach out in and of itself, but the marketing, the promotion, the public relations that you can get from that, that will pay dividends as well. So I think that that's such an important point from a physical activity perspective. Now, Tom, let's go to you. Same question. What can our industry do to support the public health infrastructure in the country?
Well, I mean, I think one thing, first of all, we can do as docs and as healthcare providers, and I think just generally as far as public understanding, is kind of analogous to when I was working with a restaurant group, and on Diamo we were making a healthy menu, and I said, look, chefs, when you wear that jacket and someone is ordering a meal from this menu, you are a healthcare provider. Gyms, to me, and I mean this personally as well as professionally, are healthcare centers. I don't think we need to again, we don't need.
You muted yourself.
I know excuse me, we don't need more data to show us that the evidence on exercise and even infection, we saw the large analysis, the massive meta-analysis of almost 600,000 people. I just put up the link from Glasgow on the reduced risk for contracting, dying from COVID-19 and multiple other forms of infection, and the enhancement of the vaccination itself. I mean, I think, to be honest with you personally, it was a terrible idea to to shut down gym facilities with such, frankly, callousness, and even in specific fact, for instance, cardiac rehabilitation programs, when in 2020, the number one killer was still, no shock and surprise, heart disease, something that many in my area would argue is probably 80% of the cases of early heart disease are, before the age of 80 or maybe even arguably 90 are preventable. So the first and foremost thing I think is to be proud of the fact that fitness facilities are healthcare facilities. As far as I'm concerned, you can call it an adjunct if you want. As far as I'm concerned, it's not. I mean, if you look at the American Heart Association, Simple 7, there's physical activity. And there are certain aspects of physical activity, if I can say, that you really just, you can, I don't think most people can do their best, particularly without them, particularly when it comes to strength training. I mean, the equipment that really helps with strength training, while you can do some bands, and I'm all for it, whatever you can do, I'm the neat freak guy, right? Non-exercise activity time, park even longer to get to the gym. But people can't afford to buy all the equipment that can really optimize strength training. As just one example of how, no matter how you slice it, it's really not an option. Fitness facilities are health care facilities, as far as I'm concerned, and that's the message that I try to project.
Yeah, so I do think it's a change in our perspective and ideology as an industry to a certain extent. I think a lot of us viewed ourselves for probably a very long time as fitness or weight loss or bodybuilding or whatever the iterations the industry has gone through over the years. But now it's very clear, based on all the research that's coming out, the role we play on the healthcare continuum. And Tom, I want to ask a follow-up question really quick, specific to strength training. And I'm sure I can ask this question to Tony as well, but I'll pose it to you. We're starting to realize very quickly, based upon a mounting body of research, the critical role that strength training plays in longevity and vitality and helping treat something like diabetes. You just want to touch on maybe a couple of points from the research there about the critical, vital role strength training plays in overall health?
In fact, even in emerging data in dementia prevention. I mean, maintenance of active lean tissue mass is critical. And frankly, it's, when it comes to healthy aging, the best way, unless you have a very disappearing type of manual labor job as you're aging, which is, kind of in a sense, a contradiction in current terms, rather therapeutic type of resistance training is critical to maintaining lean tissue mass. And then in that regard, reduction in fracture risk when it comes to falling, obviously enhancement of blood sugar control, because let's face it, you're talking about the size of the motor, and the more the larger and better running motor you have, the more you can burn that glucose and other calories when it comes to obviously mental health and so forth on down the line. The multitude of benefits from strength training are really from across the spectrum: building in heart disease, diabetes management, dementia. I would say that in insulin resistance control, I would say we probably could even extrapolate to many reduced risks of many cancers. It's part of the spectrum. Aerobic fitness, fantastic. Flexibility, yes. Strength training, absolutely is part of it, particularly as it comes to a healthy aging.
Yeah, and one of the studies that sticks out in my mind, and it used hand grip strength as a proxy for overall strength, and it found that was the biggest predictor of longevity amongst a whole host of measures. And I cannot remember the size of the population for the study, but it was some massive population-based type of study. And it just shows that the maintenance of lean tissue is so critical. And I think as technology becomes more sophisticated in the labs, I think we're going to find even more and more and more of the role that strength training plays. And I want to carry this question on to John, but there's one point I want to bring up that maybe the three gentlemen on the panel won't be able to bring up. And it's just an observation that I have, being in the industry for 22 years, about the kind of the shift in the orthopedic stability, if you will, of the populations we work with. My company opened in 2007. We started with circuit training, and we're primarily a circuit training facility. There's a lot of circuit training out there. And what I've seen over the years and I've observed is that the population that's coming through our door, they're just less orthopedically sound. Their posture has gotten worse. Arthritis has gotten worse. They're just in a just a poor biomechanical position to perform a lot of the standard circuit training exercises that have existed over time. So while that small apparatus, bands and balls and body weight are great, if we don't develop foundational strength in the population we're working with, we do increase the risk of injury from the exercises that they're doing. And at this point, unless you're willing to go buy a tonal for $4,000 or $5,000 or whatever that machine costs, the only way you're getting good strength training is at a gym. So I think that you bringing that up, Tom, is such an important point.
Mike, can I just add that that is a product of a physically illiterate culture.
Yeah, exactly. You nailed it. And it's that vicious cycle too. You said it. Yeah, I wish that I could do a time lapse of the video of classes back in 2007 to 2020 and just watch the posture of the people that come through our door just so slowly sink to this and go, man, is it even appropriate for the average person who's coming through our door to do what they were doing back in 2007? And I think the answer to that, to a great degree, is strength training. And I'm a big meathead, so I could talk about this forever. So we better get me off this topic before I derail the whole conversation. But John, how about you, from your perspective, from a mental health standpoint? And I think what Tom and what Tony are talking about, everyone's like, okay, yeah, I get it. Like that seems like a space that gyms can occupy. But from a mental health perspective, what do you think we can be doing to support the nation's public health system?
Well, first, I would say that if Tom is going to say that gyms and facilities are healthcare facilities, then they're also mental health care facilities. I mean, they truly are. I mean, if you take some of the big rock components of going to a gym or getting exercise, you're talking about mood enhancement. You are literally talking about desensitizing yourself to anxiety severity, depressive symptoms, this tolerance of uncertainty. All of that goes in a healthier, more virtuous direction as you increase physical strength, resistance training, strength training, cardio, all to different extents. So you got mood. So how, like, presenting your facility as like, hey, this is a mood enhancement facility, program, whatever, building. This is all about mental health care as well. Even in the physical health component, I think there's not enough emphasis that puts on the connection between physical health and self-esteem and body image and cognitive functioning. I mean, you're talking about complex executive functioning that is highly tied to physical activity and physical health. Memory, flexible thinking, self-control, decision-making, planning, time management. These are all things that improve with physical health, right? And as executive functioning declines, following directions, handling emotions, attention and focus, all of those things deteriorate. So just in terms of the physical component, things can be emphasized within the kind of the brain chemistry, brain functioning of different areas of the brain and executive functioning. And then obviously, this idea of social connection and this idea of like mutual support, motivation, competition, commitment, like that can't be overemphasized in terms of what you're getting from going to and participating in a gym. One of the very first ever sports psychology, you could call it that, studies done in 1899 by a dude named Norman Triplett was just a guy cycling on a track is going to do better and have better times if he's cycling against other people. And so this idea of like building social connection, support, the things that people talk about at gyms is not just lifting weights. It's like relationship stuff and family stuff and work stuff and social stuff. And that benefit can't be underemphasized enough. I mean, can't be emphasized enough. I think, and this is where this is where sports psychology has made its bread and butter from goal setting, right? So this is where I think COVID has had the biggest impact to me is goals during COVID have been made more difficult, put on hold, or in some cases just totally dashed against the rocks. So if goals are associated with motivation, any meta-analysis on goal setting will tell you that goal setting is highly connected to motivation. Clearly, COVID has destroyed a lot of that. So how do you then get to continue that physical activity, push yourself, be healthy, eat healthy, be physically active, learn physical literacy if those goals have been deteriorated? And that's where, my shift has been more toward values. So how are you pushing values that actually, if goals secure motivation, then to me, values secure commitment. Right? Commitment is the actual action. I'm motivated. I mean, Tom, in his article that I read of his on healthy lifestyle change, he commented multiple times about how, motivated people, this conundrum of like, I'm motivated to do this, I just can't get myself to do it. Well, when you connect goals and when you connect action in everyday life to your values, what do I value? I mean, I was a college soccer player, Kalamazoo College. After college, it became very difficult for me to maintain my physical health and activity, honestly, because my values were in the competition, the challenge, the growth, the team, winning, the connection and reliability, the leadership. And that's what drove me, is those values. So what gyms, I think, can be doing in addition is like, let's de-emphasize. Goals are great. Everybody, I'm not going to sit here and say it's not about the destination, but it better be about the journey too. And what can I do today to move myself toward the end goal that I want, while maintaining the focus on what I value, whether that's connection with my 4-year-old, if that's why I want to be socially or physically active, so that I can play soccer with him and throw the football with him when I'm 60 and he's 20. That's what's motivating and driving me toward that commitment. So what are those values? I think gyms in general can continue to or enhance their emphasis on the mental health component, mood enhancement, the physical health component of brain health and memory and attention and executive functioning and decision making, the social connection and how that is enhanced, mental health through being at a gym and being in those type of environments. So I think one of the things that the actionable piece is, where it behooves me as a mental health professional, a sports psychology professional, to send people to Mike's gym, to get like, hey, go to AFS, do yoga at this, partnering with partnerships between yoga studios, gyms, facilities like that, and mental health companies or businesses that align with values is a great way to have this virtuous cycle created, where gym owners are sending people to, for workshops, or they're doing collaborative workshops where you're talking about yoga and mindfulness or yoga and values, things of that nature that you can collaborate on to promote the physical health component while promoting the mental health component, that make each of those easier and more accessible. And I can say more certainly about, the more acceptance and commitment versus cognitive behavioral approaches, but maybe I'll save that for a minute.
No, John, that's great.
May I comment on that? That there was one thing that really struck me, and I was waiting for you to say, John, that it's actually a mental health drug. I mean, fitness and facilities like that, the data on depression and anxiety, not just to prevent, but actually to treat. And I can tell you, in my clinical career, I had much easier time if a patient desired to reduce reliance on medications. I said, well, in a vacuum, that's nice, but I can give you an alternative drug to that drug that you're taking that will give you as good and maybe better effects ultimately. Now, you might have to pay 30 minutes of investing a little stress to avoid a lot, if you will. But the effects are real, they're documented: depression, anxiety. And I think that you presented a thought as far as actionable, and being that I've done this, my most longstanding membership, whatever facility you go to, happens to be at Powerhouse, and they've invited me to speak several times. And now I'm thinking about it, having invited speakers like Dr. Moreno, Dr. Evans, myself, you, Mike, to bring in, I think, those that understand as potentially topic speakers might be a thought. Talk about diabetes and the link to you're going to the gym, or that your parents have dementia, but that's not necessarily your fate. That even if it's genetics, loads the gun, lifestyle pulls the trigger, if you will. Could be a way to just right off the cuff and draw that link that there really is, as far as I'm concerned, fitness centers are healthcare facilities.
Yeah, so I'm hearing a couple of common themes that I just want to point out for everyone and highlight, because I think they're so important. The first thing that was said by pretty much everyone is we have to now reimagine ourselves a bit as an industry. And I think we're starting to do that as actually a legitimate constituent on the public health continuum. The other thing I'm hearing, and it was echoed by all three panelists, are partnerships and collaborations. This is not something that we can do on our own. This is not something we can do in the vacuum of just our own four walls of our gym and fitness center. I think the MFCA's existence is an example of our realization that collaboration is needed, but that's intra-industry collaboration. I think collaborating with professionals like these three gentlemen, with local doctors' offices, with physical therapy clinics, with mental health professionals. What's interesting in what John said is I think we often think, hey, go down the road to the physical therapy clinic and talk to that physical therapist about post-rehab programs. That makes a lot of sense for us. But I think what we don't as often do is go down the road to the local psychologist who's treating people with anxiety and depression and say, hey, do you want to come down to our facility, check it out, do a couple workouts for free, and see if this might be a place for you to send your patients to? And better yet, would you like to come in and do a seminar on depression and exercise, or in Tom's case, diabetes and exercise, or in Tony's case, physical literacy and the importance of that throughout the lifespan? So I think there's a lot of opportunities for collaborative partnerships. And I think if we've taken nothing else out of COVID as an industry, I hope we've taken out of the fact that we can't be siloed in our four walls of our facilities and hope to survive as an industry. We have to get out there and we have to collaborate and we have to network, and it has to be with the healthcare continuum if we want to be considered a part of that.
I think too, there, in my experience, one of the unfortunate challenges is there's let's use a different word. There's a lot of shyness. I don't necessarily want to say, go. Well, there's even to a degree of self-loathing people have, and walking into a gym is sometimes intimidating. And I've seen some great experiences where people realize it's really more a perception than a reality. But if there's anything that we can do, or fitness facilities can do to address the people who are contemplating, but can really maybe break through that by a real clear message. You are welcome here. This is a place where there's no judgment zone. We will, if you will, we will cheer you on. We're not whatever you were thinking of. It's not, if you pardon me, it's not a meathead facility. Really everyone is here, all sizes, all shapes. Everyone's welcome, and I think that might be one extra arrow in the quiver as far as the messaging out to the public and welcoming people of all shapes, sizes, and so on. So,
well, do you mind if I kind of piggyback on that for a second,
ahead.
Mike? So I think the connection I would make there also is that our culture is a lot based around what I would call experiential and emotional avoidance. Like if it's anxiety provoking or makes me feel sad or nervous, then I should avoid doing it. And we do this and goals have this, this focus on the future of I have to achieve the goal. And if I don't, there's a lot of judgment. I think where we can change this attitude is adopting more of an experiential emotional acceptance piece where look, to Tony's point earlier, he goes to the gym, he plays basketball, he does these things because they're fun, but he also understands the importance of it. There is discomfort that comes from going to the gym, whether it's financial, logistical, emotional, physical, self-image, shame. There is discomfort. And something that emotional acceptance and experiential acceptance can do is it gets you comfortable with that discomfort. There is short-term discomfort that comes from living our values. And if we can endure that, if we can justify that with the long-term value and the long-term benefit and fulfillment and achievement that comes from doing that, then that short-term unhappiness or the run that you go on or the lifting that hurts your muscles or that you feel sore with or that you feel embarrassed because that dude over there is benching 300 and I'm only benching 180, then you get comfortable with that discomfort and you justify putting up with it. And I think emotional and experiential acceptance promotes that, which is just expanding that comfort zone by knowing there's going to be aspects of my life that are uncomfortable, but ultimately they lead me toward my values. And ultimately doing that is going to lead me toward a healthier lifestyle and a healthier spouse, father, friend, job. All that's going to improve, but I have to be willing to endure that some of that short-term discomfort.
Yeah, and practically speaking, the reason that John's saying this is not necessarily because maybe any of us listening think going to the gym is uncomfortable. In fact, we probably all love it because we spend all day there. But that is the perspective of many of our clients, and we won't have time to touch on acceptance and commitment training here, which is where John's area of expertise is, and talking about the difference between values and goals. But John, I bet there's, not to put you on the spot, but I bet you there's probably something that you can send to me that I could send out to attendees afterwards to explain this a little better. Because even if you're a gym owner or an operator, maybe you're not a trainer or a coach who directly works with people, understanding the difference between values and goals and understanding that perspective that our members bring through the door, which sometimes causes them to not come through the door, I think can be so critically important. Just that empathy and understanding of putting yourself in their shoes. Tony, did you have something to add there?
Well, I'm just going to piggyback on Dr. Rafai and Dr. Evans here on a number of things. And I think Dr. Tom, you said it well earlier, fitness centers, gyms, you are the health hub in your community. And you should be that central place where people congregate to share and discuss all issues, whether it be physical or mental health, because we know, as Dr. Evans mentioned, they're integrated into each other. And if I was in the shoes of many of your facility operators and gym owners, I would embrace, opportunities to endorse physical education in your community. One of the things that I can speak confidently about youth, if it's not fun, they're not going to do it. The number one reason kids participate in physical activity is because it's fun. The number one reason that they don't is because it's not fun. And I'm pretty sure you can probably find similar findings among adult models as well. So we have to start create engaging opportunities that, as you said, Mike, are innovative and different so that they can be confident and confident movers, whether it's rock climbing or kayaking or backpacking or going to the gym or ultimate frisbee in a community recreation setting, whatever it might be. And schools aren't going to do it by themselves, and the private sector is not going to do it by themselves. It's going to take some type of collaborative effort, because what we're talking about is a cradle to grave ideal here, and that's what we're trying to perpetuate. And again, this is where gyms and fitness centers become important, because after that high school and that young adult movement experience, where is it that people can fulfill this opportunity to perpetuate that journey that Dr. Evans talked about? So it's important, just as a parting comment, support and co-brand with community recreation programs and physical educators in your community, because the private fitness sector is a continuum of the physically literate journey. It's an adult playground. It's an adult recess. That's the way I look at it, just as a participant. That's where I like to play. So we need to think long-term, broad focus, but again, creates that programming that delivers that competence and confidence piece that will enable a physically literate culture.
I love it. I don't know if I've ever thought of my fitness center as an adult playground, but it certainly is for me. And I definitely think that that's how I'm going to start to view it. I think that that's such a great point. Tom, were you going to say something?
Well, I mean, I just wanted to say at risk of getting, too personal, but, this term of, quarantine 15, the COVID-19 weight gain. In fact, there was a survey, I think of thousands, I can't remember how many Americans, but over 40% gained weight. And the amount that those did on average under the stay-at-home orders, the amount that on average was, just shocking, 29 pounds. That's devastating. I myself, when I was restricted from the gym, I tried my best to, walking. I was doing pull-ups from the beam in my basement. I was trying to do push-ups. It was not even close to replacing. I gained 17 pounds myself. I'm sure that I had muscle loss, and I'm finally now coming anywhere near close to. So, I'm an N of 1. But I can just tell you and I'm pretty dedicated to my physical health. Taking away that facility, I'm going to put it that way. And I hope in retrospect, if anything like this happens again, and if necessary, we need to do what we need to do as a society for the overall, but be very careful about taking away a therapeutic facility like gym facilities, and keep in mind the power of the data when you take that away. And I think we're going to rue the decision to close gyms as long as they were. And it's not something you can gain physiologically, the human body can gain body fat and lose muscle much easier than it can do the opposite. And, it's a lot of price to pay. So that is just something I wanted to add in terms of the value I personally take as far as it not just being a playground, but a therapeutic playground that could still be the drug that we're all taught. It's all of that. It really is one of the pillars of lifestyle as medicine. For me, I don't think I can ever really replace a gym facility entirely with other physical activity. I mean, I would do my best, but it's not going to be as good as it is. I'm a self-admitted gym rat. There you go.
Well, guys, this has been great. We do have a couple of minutes for questions, so if anybody wants to drop those in the chat or in the Q&A feature, we're happy to do it. If we can't get to your question, by all means, you can email us afterwards, and I'd be happy to throw it out to these three gentlemen to get their insight. Any resources that we referenced here, I'll make sure I get out an email form to you afterwards. Tony mentioned the physical activity plan, the National Youth Sports Initiative. I'll push that out. John will send me some incredible document on ACT that I think you guys will find very helpful. Tom, if there's anything that you think is helpful, please feel free to send out. And I think the big thing that I want to sum this up with by saying is just reiterate a lot of what our panelists said today, is that COVID's a perspective shift for our entire world and society. And I think it's a major perspective shift for our industry. And I think what these three gentlemen brought up today are critically important. And to just highlight those things, one, it's changing our perspective on what we are as an industry. We are no longer fitness. We're not even just wellness. We are part of the healthcare continuum. We are part of it. Secondly, partnerships are critical, and getting out from the four walls of our facility and not just partnering with the obvious community partners like a smoothie shop or a physical therapy clinic, but thinking about metabolic health doctors, thinking about physical activity programs, both in school districts and just community recreation programs, finding your local psychologists and psychiatrists that are looking to augment or maybe replace their medication regimes with their patients with physical activity. There's so many opportunities for partnerships. We have to get creative, and we have to work together. And for everyone who's on here today, I think you've made the first step to working together because you're willing to hear this message, but it can't stop here. It's great that we have this academic knowledge of what we need to do, but the only way we're going to ascend to a legitimate element of the public health continuum in this country is to actually put our boots on the ground and start to work to accomplish some of these things. And as the MFCA, we look to be advocating for this with our federal and state government, but we also look to be putting on future webinars and thought panels on how we can actually go about accomplishing this. But this is just the beginning of that conversation. And I'm grateful for everyone joining us today. Look for an email in the next 24 hours that has more information, has a video link, and anything else you may want to find out about today's webinar. If you found this valuable, please make sure you share the video with your friends. We'll have it up on the MFCA YouTube channel. Connect with us on Facebook. We have a Facebook group for the MFCA to keep up to date on all the happenings that are going on, especially a lot of the legislative work we're doing right now. We're working really hard to get a $90 million package passed through the state Congress for direct aid for gyms and fitness centers, for rent relief for the past 6 months. So a lot of happenings going on for everyone to stay updated on. So please check us out. Gentlemen, is there anything you would like to leave the group with in closing?
What can I say other than take what we've given you and please make the most of it. We're here for you. And Mike, Tony, and John, it's an honor. Thank you very much, everybody.
I just want to reiterate Tom's sentiments. Thank you for the invitation. It was very nice to serve on a panel with these distinguished guests. I gained some information myself by listening to Tom and John. So thank you.
John, anything you want to leave us with?
I mean, I think we said, I think, look, you can't take them all. They all have to come together. You can't just do one of these. Like, you can't focus on just mental health, just obesity, just physical literacy. They all are going to stand each other up. And like Mike said, like work through those partnerships and collaborations in a creative way. I think that's the best solution.
Absolutely. Well,
Appreciate it, guys. Thank you so much.
Yep, we have a rallying cry going away from this. So now we have to make it happen. Thank you, everyone, for joining us. Gentlemen, once again, my sincere gratitude for your expertise on the panel today. And we look forward to seeing everyone back here next month towards the end of May for our next webinar. So be on the lookout for that. Thank you so much.
Thanks, Mike.